When I work at the Women's Health Center, I see patients from all over the province who've had an unplanned, unwanted pregnancy, which is something that happens to, about 1 in 5 women in our province and in Canada. 1 in 3 women need an abortion sometime in their lifetime. And here I am as a physician doing an abortion that the public is paying for at the cost of $2,200 per procedure. And when that woman says to me, I would like a long-acting, for example, hormonal IUD, please, that would last me for 5 to 7 years, but I can't afford it and it's going to cost $400. I spend a lot of my time running around trying to find coverage for people to have the contraception they need. And it's craziness. It's penny wise, pound foolish, as I've said, to fund abortions and not fund people who want to use good contraception.
What is the impact? What would it change here if Saskatchewan had coverage, universal coverage for contraceptives?
Okay, well, it would change the options for every single woman who has to make a contraceptive decision. Birth control pills cost probably between $200 and $300 a year. The very best methods, as I mentioned, what we call long-acting reversible contraceptives, so things like IUDs and implants, cost $400, $500. And they're not covered under the public system. So if you are Indigenous, they may be covered by NIHB. And if you have a job that has benefits and private coverage, you can access that. But there's a whole group of women, and mainly young women, who don't fall into either of those categories, right? They're either students, or they're between jobs, or they're marginalized, or they are single-parent mothers, and they just can't afford the best methods of contraception. So what it would mean if you had universal coverage is that women could afford to make that decision based on what works for them in their relationships, in their life. If they know they're not going to have a baby for the next 5 years, they could choose a long-acting reversible method and not run into the kinds of access difficulties that we hear about all the time.
You keep talking and mentioning the power for women to choose. I don't know if people completely, who don't have access to making decisions and that power, can you elaborate on that power a little bit more?
Well, I can tell you that the minute I got accepted to medical school, the first thing I thought was, can't get pregnant. Gotta deal with this. Because, the previous generation to mine, and even many women in my generation, their whole lives, their careers, their relationships were all defined by whether they could control their reproduction, right? This revolutionized the lives of women. It meant you could decide to go to medical school and have your babies afterwards, or plan your babies. That's not something a previous generation of women, or many women around the world, get to do. And it's a basic right that I think we have to fight for and defend. And it increasingly relies on being able to afford the best methods of contraception. We have a lot of work to do in educating young women about, the benefits of certain methods of contraception, but they all want to have that control. Mm-hmm. And as a society, it's very important. Planned motherhood is a healthy thing. Women who are able to plan their pregnancies and decide when they're going to have babies, seek care, get good prenatal care, have healthy babies, don't die in the process, or have babies that are born, prematurely, or suffer. Unplanned pregnancy is very expensive. Mm-hmm. And we are having fewer and fewer teenage pregnancies because we're giving young people access to contraception. It's just that it isn't good enough yet. And they're often the people that fall between the cracks financially.
Why do you think that it's such an uncomfortable conversation? Like, you and I can talk openly about this, but not everyone can talk openly about contraception or about abortions. Why do you think it's still so uncomfortable when it's something that a lot of people use and need?
Well, I think it probably goes back to kind of moralism about sexuality, fundamentally. I think there are lots of probably largely older and maybe male citizens of the province who don't want to think about, women being sexually active when they're not wanting to have babies. Somehow those two are married in some people's minds. Obviously, they're not married. They're very different. So I think that's part of it. There's been so much judgment and denunciation of women who have abortions over the years. I think things have changed. People are more accepting. They now realize that 1 in 3 women needs an abortion sometime in their lifetime. It's more common than breast cancer or all of these, diseases that we associate with women and women's choice. So I think, that's part of it. A fundamental distrust too of women, that somehow people think they don't make good decisions about their reproduction, and that always shocks me. Even women who are having abortions say to me, "Well, I'm not using this as birth control." Well, nobody suspected you were using this as birth control. It's just that any woman who's faced with a decision about whether she's in a position in her life to have a baby right now and do it well deserves our support to make that decision. She knows best. That's why I do this work, is because I don't think I can make that decision for any woman. I know I made that decision for myself with my partner, and I have to give women that right to make that decision. And honestly, they make very wise decisions. I have a great deal of faith in women to make good decisions about themselves and their children, because it's very important to them.
I think that's a good place to leave it. Thank you so much.
All right, good.